friend, Dr. Aaron Casano from Anchorage Valley Radiation Therapy Center. And thank you for joining us.
Thank you.
And the first question we have is, what is oral cancer? Oral cancer can be any kind of cancer of your oral tissue, your lips, your mouth, around your teeth, or even in the back of your mouth near your throat. It can show up silently and be there for many years before it's discovered, which is the importance of seeing a dentist regularly and seeing your medical doctor just to be checked up and look for those things. It can show up as signs of lumps and bumps, or redness, white patches, or even look like an ulcer or some kind of a sore that just doesn't seem to heal and stays there for a long time.
Nice. Well, you kind of took part of my answer, so that's great. Dentists are on the front line for oral cancer detection. The next question is, what role do we as dentists play in oral cancer awareness and prevention? Often, dentists are the medical providers that patients see most frequently, and so every time you come to see us, we're providing an exam and we're looking for different signs and symptoms of oral cancer. One of the things that I say before I start every exam is, okay, I'm going to start outside your mouth feeling for any abnormal lumps and bumps. Let me know if anything feels sore, tender, or uneven. And that it sets me up to remember what I'm doing, but also gives the patient awareness of what's going on, and so they can be aware and feeling for things that I can't feel myself in their own mouth. So we're looking for abnormal lumps and bumps, and the things like Dr. Marchand said, red spots, white spots, things that don't heal, and then we create a plan moving forward.
Question. So what happens if a dentist discovers a suspicious spot? Well, first thing we're going to do is, based on our experience, evaluate that spot, see if it's something that's of concern, if it's abnormal, if it's in other spots of the mouth that would indicate that maybe it's more normal. And we might even evaluate it for a week before we send you over to an oral surgeon, which would be the next step. And they would do the same thing, an evaluation, maybe some imaging, anywhere from CT scans to other x-rays, MRIs. And then they would make an evaluation of how severe, what's the urgency of this. If it's discovered that it's cancer, then we would start you up with a team of professionals, including Dr. Cusano at Anchorage and Valley Radiation Therapy Centers. And he would work with other professionals to develop a plan for treatment so that you can have the best outcome and the least amount of morbidity from an oral cancer. Oral cancers are pretty rare, but when they happen, they can be catastrophic and very serious, and so early detection and treatment is very important.
Absolutely. Well, we have a question that was submitted via Facebook, so I'm just going to go ahead and read it first and then address the question. This question says, I've been told oral radiation received is less than radiation received as part of cancer treatment. I had 6 weeks, 5 days per week of radiation on the right side 10 years ago. My nurse said, try not to have any more radiation than is very necessary going forward. That's difficult because so many medical devices utilize radiation and are said to be necessary. Now, my hair on my right side is 2 inches shorter than the other side. Facial skin on the right side may have some acne or eczema, and vision is worse in the right eye. I'm very aware scattered site radiation could be the culprit, but I'm not sure what can be done or how to move forward because, for example, I don't understand how much radiation an MRI scanner emits compared with a mammography scanner. And unfortunately, I've had many issues requiring use of machines which utilize radiation during the past 10 years. This is a really great question, and it points to some of the survivorship issues that many patients are dealing with after head and neck radiation. But I'll go ahead and point by point answer these questions. The first question that is of concern is the utility of radiation for diagnostic reasons. So I always counsel my patients that once you are a head and neck cancer survivor or a cancer survivor of any type, the utility of scans such as CT scans and X-rays or PET scans, those are all extremely important in detecting whether or not we have something to be worried about. So the dose that is received by those diagnostic scans when we're specifically trying to address a medical issue, it is trivial and I would say medically necessary. So I wouldn't have any concerns about recommendations for a CT scan or an X-ray as they pertain to trying to monitor monitor things that may be a health issue, both in the area that was treated or in other sites of the body. That dose is extremely minimal compared to the radiation dose that you received as part of your treatment. So that is correct. The scans that we use are a minuscule amount of radiation compared to even just 1 day of radiation treatment. To the second question of what to be done going forward, I would say working with a team that understands we want to use the technologies and imaging modalities that have the least amount of radiation as possible and only use them when necessary. So things like dental x-rays and CAT scans, as I mentioned, are a really important part of survivorship, and I would not worry at all about those. But then the other scans that there are some concerns about how much radiation may be in an MRI scanner or a mammography scanner. Mammographies actually, in the grand scheme of things, are actually a very small amount of radiation, and the benefit of picking up a breast cancer far outweighs any concerns that I would have about the risk of the x-ray dose from that mammogram. And to the point about what other types of technologies are going to be having radiation that's emitted, the radiation from a mammogram is not going to be a concern with scatter dose to the head and neck area. And to the question of an MRI actually has no radiation whatsoever. So the imaging modalities that we think about that emit x-rays and potentially have radiation exposures are going to be either CT scans or x-rays or PET scans. When we talk about MRIs, those are just magnets that are aligning up the water molecules in your body, so there are no x-rays with an MRI. And the other modality that we use very commonly would be an ultrasound, and that is a very quick and easy exam that utilizes sound waves, and so there is absolutely no radiation with those scans either.
Fantastic. So I think to sum up, you would add that regular visits to your doctor and dentist, early detection, early intervention, and then continued monitoring
Absolutely.
to prevent any further relapse or issues.
Yes, absolutely. And that really underscores the teamwork that goes into this, because it is not just one provider that is seeing and making all the decisions. We rely on a team of folks just like yourselves that are helping with survivorship issues for patients that are post-treatment, but also being at the first line of picking up things so that they can have a best outcome without having to have very intensive treatment.
Yeah. That's fantastic. I've had personal patients where I've diagnosed and biopsied and found the cancer and was able to get them referred quickly enough that they were able to just surgically create an intervention and need nothing further, which is fantastic because there's no other trauma or problems that are created, which was really great for her.
Absolutely.
So, well, thank you for joining us. And to learn more about what we've discussed today, you can reach out to us directly or on our social media platforms. And we'll list all the information in the comments below. And thank you again, and enjoy the rest of your Thursday.
Thank you.
Thank you.